Good evening, doctors. Welcome again. Today we are going to discuss about bacterial infection. LGV is caused by LGV is mainly caused by chlamydia trachomatis. LGV is lymphogranuloma venerum. Incubation period for syphilis is 9 to 90 days. TB of skin is known as lupus vulgaris. Lupus vulgaris. Most common nerve involved in leprosy is ulnar nerve. Drug of choice with type 1 lepra reaction with severe neuritis is systemic steroids. Nerve abscess in tuberculoid leprosy is best treated by aspiration. Okay, now moth-eaten alopecia is seen in secondary syphilis. Which of the following organism is responsible for vesicular eruption and honey-colored crust over face? Staphylococcus aureus. Apple jelly nodules on endoscopy is a feature of lupus vulgaris. Which of the following condition present with purulent urethral discharge? Gonorrhea. 24-year-old man complains of mild urethral discharge after sexual contact with sex worker. Drug used to treat such patient is azithromycin 1 gram single dose. Azithromycin 1 gram single dose. Okay. Now, confirmation of congenital syphilis is done by FDA ABS. Drug of choice for syphilis is benzathine penicillin. RPR test is done for syphilis. Sebar tibia is associated with congenital syphilis. Congenital syphilis. Okay. Lepramin test positive in tuberculoid leprosy. Tuberculoid leprosy. Suppurative buboes are seen in infection with Haemophilus ducrei. Non-gonococcal urethritis is caused by chlamydia. ये सेम क्वेश्चन रिपीट है. दिस इज एजिथ्रोमाइसिन 1 gram single oral dose. Okay. Very numerous symmetrical distributed erythematous or copper colored shiny macules papules are feature of lepromatous leprosy. Okay. Yeah. Diagnostic test for syphilis is FDA ABS. Okay. Which is not a sexually transmitted disease? Yaws is not a sexually transmitted disease. Hyperlobatum is seen in late syphilis. End stage or tertiary syphilis is late syphilis. Okay. Bulla's impetigo is caused by Staphylococcus aureus. Bulla's impetigo is caused by Staph aureus. Okay. Lepramin test is strongly positive for tuberculoid. Lepramin reaction patient is specific leprosy, tuberculoid and borderline tuberculoid. Okay, so this is tuberculoid leprosy. Chancroids is caused by Haemophilus ducrei. Which of the following is associated with leprosy? Formihistiocytes, epithelioid cells, non-scintillating granulomas, all of the above. Okay. All of the following are commonly disseminated gonococcal infection except it does not involve liver. Non-Neisseria gonorrhea infection can occur resulting in endocarditis, meningitis, arthritis, arthralgia, tenosynovitis, painless, non-pruritic dermatitis. Okay. Which of the following is true for multibacillary leprosy? True. So all of the above is true. D. Asymmetrical several nerves thickening with several hypothetic macules on skin indicated which stage of leprosy, that is borderline lepromatous. Innumerable small normostatic and symmetrical skin lesions are present in which type of leprosy? Answer in a comment box. Okay. WHO recommendation. Duration of treatment for multibacillary leprosy is 12 months, whereas paucibacillary leprosy is 6 months treatment. Okay. Most important, establishing diagnosis of leprosy is by slit smear for AFB. Presence of AFB is suggestive of skin lesions even in the absence of sensory deficit confirms the diagnosis of leprosy. Leprosy test is not a diagnostic importance but in prognostic importance. Okay. Which of the following organism responsible for vesicular eruption and honey colored crusted over face? Impetigo contagiosa caused commonly Staph aureus. So here answer is Staph aureus. Apple jelly nodules on diascopy is a feature of lupus vulgaris. Which of the following condition present with purulent urethral discharge is gonorrhea? Gonorrhea. Which of the following test is not a test for syphilis? That is Frey's test. Frey test. Okay. So hope till here it's clear. Now let's discuss more. Which of the following not affected in leprosy? Uterus is not affected in leprosy. Eyes, testes, retroendothelial system, whereas nerves affected. All of the following conditions may present with genital ulceration except gonorrhea not associated. An adult went for a leisure trip. Now, after 2 weeks, he presented with fever, rubrizinital ulcer, enlarged inguinal lymph nodes. Most probable causative agent is lymphogranuloma venereum, that is chlamydia trachomatis. Which of the following skin condition is associated with TB? Erythema nodosum. Which stage of syphilis associated with term moth-eaten alopecia? That is secondary syphilis. Causative agent for erythrasma, Corynebacterium minutismum. True regarding lymphogranuloma venerum are all except Ferry test is obsolete. Intradermal skin test, yes. Diagnostic LGV depends mainly demonstration of rise of group specific complement fixation antibodies. So see and write in the comment box. Lepramin test positive for tuberculoid leprosy. Okay, tuberculoid. So guys, this is I already finished with bacterial infection. If you have any queries, any question regarding this, you can ask me. And if you are new on my channel, please subscribe it. Thank you. Good day. Goodbye. That's all for today.